Hey guys, what's up? Welcome back to Haley's Comments, or hey if you're new. Today I am here with Chris from Me with ADHD and we are going to be talking about medication. So if you guys are new here, I have a series on my channel called Coffee Talk where I talk about ADHD, depression, and anxiety. And Chris has an awesome channel all about ADHD. Do you want to tell them a little bit about your channel, Chris?
Sure. Hi everyone. It's me with ADHD. I do all things ADHD. We do lots of top fives and best things for ADHD, I guess. We also do a little bit more of a grounded, real life talk about certain parts of ADHD that affect my day-to-day life as well.
And you talk a lot about your medication journey as well.
That's right, yeah. I have like a series called the Adderall vlog. The idea came around when I first found out actually that I had ADHD and I was told that I was going to be on this medication. I was like, I'm going to go online and see what there is that I can find out about it, and there wasn't really anyone that I could see that was doing any real life kind of talking about medication for ADHD. So I was like, why not? It was like a unique opportunity for me because I could start from the beginning and show everybody what a real journey for like an entire year going through taking medication is like.
And that's super valuable because if you look up medication on YouTube for ADHD, a lot of what comes up is just like doctors or like parents, and that's valuable information too, but it's nice to hear from people who are actually on these medications and like hearing about your experience.
Yeah, agreed. Sometimes I feel like if you sit and watch like a medical professional talk about these things, it doesn't like resonate with you as well. Because it's just like some professional talking about it. I might as well hear the same thing from my own doctor. I wanted to hear real stories and real feelings from people. Another thing that I found when I was looking, a lot of it was actually quite negative. Some people were either talking about the side effects of taking these medications or how damaging it is to you. It was these horror stories of like people who are in school who are like just taking this medication just to pass their exams and all that kind of thing. And it was just a lot of negative, which in reality, if you either have ADHD or you've been in the ADHD community, you know that it's nowhere near like that.
Yeah. It's actually definitely in the ADHD community, it's more like people push you to be on medication, people love medication. So yeah, it is totally interesting that there's not a lot of positive support online. Today we're gonna be looking at both sides because he's on medication and I am not. I don't wanna speak for you, but I'm pretty sure neither of us are like anti either way. Like I'm definitely not anti-medication.
Right. However anybody deals with ADHD, however they get by is great. A lot of people think the medication that they take, it's like a magic fix for everything. But it's really not. There are certain symptoms that I have for ADHD where medication, I can feel it helping, but it only fixes certain parts of my ADHD.
So are you on medication right now? I know like you usually are, but I know you made a video about how sometimes you don't take it on the weekend. So are you actually on it right now?
I am. Right this very moment, I'm on my medication because I do like to not have it on weekends anymore. When I do like real important things that I know I'm gonna have to have some focus for, then I'll take the medication.
Sure. Do you want to tell them a little bit about like your experience with medication, like how you got on it, what it's been like for you, just an overview sort of thing?
Sure. When I first found out that I had ADHD, it was a rather lengthy process. When you get prescribed medication like that, you usually get counseling to go alongside it. Because at that point, you're kind of wondering how I've gone so long without kind of knowing. And I felt like it was my personality. I was always the forgetful person, or I was always the person who's late for everything, or you know, I just couldn't focus because I was like immature or something like that. But that's not really the case. At that point, you need to be counseled through that so that you don't kind of blame yourself. When I first started taking it, I was on a rather low dosage. I was on 10 milligrams of Adderall. I was actually quite worried about it when I first started taking it because I've never taken anything in my life that I thought would like kind of change me as a person. I don't know if you feel the same about those kind of medications, but I always felt like, is it gonna change who I am and I'm never gonna be the same person again? It was actually my co-worker who found out I had ADHD because normally when I have a conversation with him, I'm tapping my foot while I'm looking at my phone, while I'm doing something on my screen, at the same time as talking to him.
Yeah.
Because you know how it is. You just can't focus on one thing at once. You need a lot of things to focus on one thing. This was the first time where I literally just sat fully engaged in what he was saying without actually having to really try to do it. I couldn't even believe it. I'd never felt like that before, and I was really excited. One way that I would describe it, which is what my counselor explained it as, is it's kind of like playing baseball with one arm for your entire life. And then all of a sudden, you've just been given a second arm, and now you can play with two arms. All your life, you've kind of worked double time to do the same as everybody else, but then now all of a sudden, you can just do it yourself.
Yeah, that is so true. I feel like because of my ADHD, I have such a strong work ethic because my whole life I've worked at least twice as hard as everybody else just to like still get worse grades and whatnot. I think our experience with medication is quite different because I was like 15 years old. How old were you whenever you got put on medication?
27.
So you had made it through like school and all of that already without medication.
Oh yeah, and it was a struggle.
So how do you think that school like would have been differently if you would have been put on medication sooner?
I think I would have probably been able to focus better. I mean, that's for sure. I always got by with like C's, a little bit higher on some things. In college, when I did my dissertation, so it was like 10,000 words or whatever, we had a year to plan it, and everybody in my class had portioned it up throughout the year. And I'd been like, yeah, I got tons of time. I'll do it probably, in a couple of months. A couple of months came. At this point, I'd wrote dissertation on a piece of paper, and that was it. And I was like, yeah, it's fine. And then it came like a week before it had to be handed in. At this point, that's when the dopamines kicked in for me. And I'm like, oh crap, I've got to get this done now. That's when like my hyperfocus kicks in, and then I start doing it. The people who have spent all year trying to get their projects done, while their way of doing it is better, it's not necessarily they're working harder than me, because I'm doing that same amount of work, but I'm condensing it down to like a week or a few days, because that's how good hyperfocus is. It just kind of, you don't have the focus for the rest of the time, but when you do hyperfocus, it's like you focus better than anybody who doesn't have ADHD. They can't even compare to that.
Yeah.
I don't think that I would ever say that I wish that I took it back then. When I first found out I had ADHD, I was like, Dad, how did you not notice that I was ADHD when I was a kid? Like, and he was like, I did. And I was like, what? And he's like, but that's just you, son. I love you for who you are and how you are. And I was like, but I could have done so much more, and I could have been so much better. But truthfully, I mean, I don't think that's necessarily true. And one other thing, I have all of these coping mechanisms for ADHD now that I've learned throughout my entire life without medication. I know how to manage my ADHD without medication, so I have no worries about not having it.
So I got put on medication after my freshman year of high school, and then I was on it all the way through college until I was like 21. I feel like those are like the most important years of your life in terms of learning how to like be a person. That's when you start to have all sorts of different responsibilities. Going to college, I had to, pay rent on time and just do basic things that are hard when you're young and immature and irresponsible. And I learned how to do all of those things with the help of medication. I never learned really any coping mechanisms. So when I finally stopped taking medication, I had to relearn how to be an adult in the real world and how to like pay my rent on time, which I'm still struggling with, and like stuff like that it's like I never had to deal with it before. So now all of a sudden when I'm 23 years old, now I'm having to relearn all of these things that I thought I was like done with.
Feel safe in the knowledge that even though I didn't take my medication till later on, I still have trouble paying my rent and managing my life. It's always a struggle. Now I've lost my train of thought. Look at us. We're like back and forth losing train of thought.
Yeah.
Standard ADHD conversation. You know what I find really funny? I don't know if you mentioned this in one of your videos. You can like talk about something and then I can like go off track and just mention something that's completely the opposite of what we're talking about, right?
That was me, yeah.
Was you, right? And other people lose like focus, but if somebody's ADHD, they follow with you and they're like, yeah, like I get that train of thought. Dude, I have that problem all the time in work. I come up with this totally like out there concept for how we're doing something or how something can be solved. And my other coworker and him are looking at me like, what? And I'm like, how do you not see that? You know? And that's
Right.
a really great thing about ADHD, by the way, is we have like this totally out there way of thinking, and that's why we're better problem solvers most of the time than they are.
Yeah, and also because I feel like we create a lot of problems for ourselves just because of our symptoms. Like, I'm always in situations where I'm running late or I've lost something, and so I'm like constantly having to problem solve, so I feel like I'm really good at it now.
Right? The best jobs for ADHD. All these jobs that require like immediate reactions. We live our life in a perpetual state of last minute.
So we are actually doing a video on his channel about like ADHD careers.
So we're gonna start a new series on my channel that follows people in different careers that have ADHD, and that's going to be about how to succeed as a YouTuber because you've just reached an awesome milestone and you have ADHD, and you know, I'm super excited to hear how you go about keeping your channel going.
Yes, definitely go and check that video out. Okay, so what did we talk about last? If you got through school without medication, what made you ultimately decide that it would still be worth it for you to take medication?
I wanted to see how it could help me. When I first started my job, I had a boss that didn't really gel very well with my personality. When the ADHD starts to slip in, you start to see how messy things can become. We didn't get along very well in that sense. My colleague had said, you know, you pretty ADHD, dude. The symptoms can be relatable to a lot of things. So I felt like I had generalized anxiety disorder at one point because of the way the emotions that I had at certain points. I felt like I had depression at certain times. Sometimes I felt like I had some kind of bipolar, or a lot of the symptoms kind of fit little bits with them, but not entirely. So when I found out about ADHD, it was the first time that every symptom fit into one category, and it was like, I can finally give a name to all of the issues that I have had. So I was more than happy at that point to see what treatment is out there.
I 100% agree with you. Even though I knew that I had ADHD, I still often thought, oh, I must have this disorder or this disorder. People really downplay how much ADHD affects you in all areas of your life. People just act like it's not that serious. So it's like you try to like figure out what other disorder it could be, but at the end of the day, it's just ADHD. Like, it just affects you in so many different ways.
It's true. It does affect you in tons of ways. I did another video on it recently where I did the ADHD test. You have to have shown 5 different signs before the age of 12 to be categorized as ADHD. Your question again was about, what was it about again?
I don't know.
It was about symptoms of ADHD. I said, you have the symptoms of ADHD. Oh my god. wait, I think I remember. How many times have I said this same sentence? Like 5 times.
Like, I don't even know where we're talking.
Oh my god.
This is my favorite collab of all time, dude.
Alright, it's so good.
You have to be, you were
Oh,
talking about that video that you made.
What? Originally, you had said about how the symptoms mix with other symptoms and they look like other diagnoses. That's right.
Yeah,
Yes.
that's right.
Right, okay.
This is really like completely irrelevant to medication though. We're like
Right.
really, really off topic.
Yeah, see, it doesn't fix everything. Yeah, you have to show these symptoms before the age of 12, and if you haven't, then as far back as you can remember. And those symptoms themselves are so expansive, I want to say. Hyperfocus. Anyone in the world can at some point say that they felt an overwhelming amount of focus on something that they're passionate about. Hyperactivity. A lot of people can be like, yeah, you know, sometimes I just feel super hyperactive, you know, I just feel like I'm totally, you know, buzzing. And because that works for every single symptom of ADHD, it leads to a lot of people sitting there and thinking, well, you know, I feel like everybody's a little bit ADHD sometimes. And it's like, no, that's not how it is. And also, that's why it fits into other diagnoses. The reality is you have to have shown all of these symptoms and very specific on those symptoms. When somebody says that they hyperfocus, it's completely different. If I hyperfocus on something, my focus is so intent that every single thing around me doesn't exist anymore. Nothing exists. I don't need to eat, I don't need to sleep, I don't need to do anything apart from what I'm doing. If I'm pulled away from that to do other things, my mind is literally right back at that thing and it will never change until I do what I need to do on it.
You constantly are talking about it, you're constantly thinking about it. It's everything in your life at that time.
Yeah, my wife is like, you're not here again, I guess, tonight, or you're not kind of with me right now, because I'm not. That's the reality of the fact it has such an adverse effect on a relationship, ADHD. You don't notice that you're not talking to other people, and you're just so focused on that nothing else exists.
So back to like when we were talking about how like everybody has ADHD, I feel like because it's a spectrum disorder, people think that, oh, I must be on like the, milder end of the spectrum. But in reality, like every person that I know who has ADHD, and I know a lot of people with ADHD, they are very clearly ADHD. Like there is no question. Anyone who meets them knows that there's like something off about them. You know what I mean?
Yeah.
So it's not like, oh, sometimes I have trouble focusing. No, it's like you are clearly very different from everybody else. So back to medication. We've gone on topic so many times, but like what are some of the main benefits that you've seen since starting medication?
An increased amount of focus. When you're ADHD, you don't get as much dopamine when you're focusing on one task. When I'm on the medication, because it's slowly feeding dopamine to my brain, I'm able to kind of focus how a normal person focuses. Well, I don't want to say normal because I don't...
Let's just be real.
Right? A neurotypical brain can focus. That's kind of the biggest benefit. I find that my brain isn't as scattered, and this is a positive, I think, but it can also be a negative. When I'm not medicated, I feel like ideas are like, boom, like all over the place. Like I have ideas running through my brain every second of every day, all day. It's a struggle to take those down and to like clearly define one idea from the rest, because they all intertwine and it all becomes a big mess. It's a little bit more streamlined. I can see the channels for where my mind is supposed to navigate. That's a big benefit. When I get into a conversation that's about something that I have an idea for, I find that my brain works so fast, my mouth can't keep up with my brain. So then,
I completely agree.
You know what I mean? And so then I start to speak and I have to cut myself off mid-sentence because I can't keep up with what I'm actually trying to say, and I jumble things up and I get all messed up. I find when I'm on medication, it just slows me down a little bit to the point where I can actually get a coherent sentence out.
That definitely happens to me when I'm talking about something. Like a lot of times I'll be like, no words are actually coming out of my mouth because I'm thinking too fast to ever like say any of the words. Which, okay, I feel like it's really interesting that you say that it slows your mind down. People think it has the opposite effect, that Adderall, is supposed to like make you like go, 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 go. For people with ADHD, stimulants have an opposite effect. So like coffee and all that, a lot of times will make us tired. So it really does slow us down.
Yeah, it's true. That's one of the most telling signs of whether you're ADHD or not, is when you take medication on how you react to it. So there was a point where I upped my medication to 20 milligrams. At that time, I was very busy at work. I stopped sleeping well. I had stopped eating well. I'd started eating a lot of garbage food and stuff. Because of that, I had felt like my medication wasn't working anymore. And I increased my dosage again to 30 milligrams. That is way too much for me. And the reason why I knew that was too much for me was because I just slowed down completely. I felt like an absolute zombie at this point. I was speaking super slowly every time I was getting a sentence out. People would ask me a question. It would take me like a couple of seconds to even respond. I felt so out of it. It just goes to show that like that wouldn't obviously have that same effect if it was somebody who wasn't, didn't have ADHD. When people talk about ADHD on YouTube, when they talk about when they've taken medications and they're not ADHD, they're like uncontrollably like energetic and they need to clean and they need to focus on doing something constantly. They just can't stop.
Whenever I first took Adderall for the first time, they didn't like ease me into it sort of thing. So if you've seen my first time trying Adderall video, I was like crazy animated for like the first couple days, and then after that I was completely chill. And then I tried another kind, Strattera, and I never had that effect.
I wonder if when you first started taking your medication, the fact that you were taking this medication, you were younger, you're kind of maybe excited about it, the fact that you're taking like the medication to help treat you. I wonder if that kind of was your initial excitement and buzz over it was what made you feel a little bit more elevated,
Yeah. That's a good point. So maybe it wasn't because of the medication that I was running around like a maniac. Maybe it was because I was finally able to like clean for the first time in my life. So I was like really excited to do it.
Yeah.
Maybe that's why, honestly. Yeah.
Yeah.
Because I've never felt
I would
like
be excited. I would be stoked if it was me,
Yeah, that's true. That's true. When people don't have ADHD, when they try ADHD medication, they feel like some sort of buzz. Like people say they feel like euphoric. And I have never in a million years felt that from anything for ADHD. ADHD.
Never.
Like, you definitely don't feel euphoric or anything like that. So that's a big misconception too. People think you're just getting high all the time.
That's true, right? That's true. And I feel the same way. I've never felt like that kind of high from it. And I have heard tons of people say that that's what they felt too.
Do you think that it helps you switch from task to task easier?
Yes and no. My day at work is dependent on how I prioritize my tasks, how I break up bigger tasks. I feel like when I'm unmedicated, I'll just pick and choose like whatever I think is what I want to do at the time. And I'll be like, I need to do this now. No, I need to do this. And then I'll go into my boss's office. I'm like, I've got so much going on and I need to do this thing and I need to do that. And he'll be sat there and he's like, well, Chris, that doesn't have to be in for like a week. Why don't you work on this that's got to be in tomorrow? And I'm like, no, because this is the thing that feels important to me at the time, and when I'm on medication, it's almost like I can take a step back and look at it. This is more important. This is more important.
Yeah, and all of the benefits that you've talked about, I definitely experienced when I was on medication. It was just a lot easier to focus, a lot easier to just see yourself from the outside of you, if that makes sense. I feel like when you have ADHD unmedicated, you're just kind of like in your own little world. But then when you're put on medication, it's like, oh, I can see what I'm supposed to do from everybody else's perspective or from like a neurotypical standpoint. And so it just helps you like function better in society.
Yes, absolutely. I know that feeling. It's crazy to look back when you're medicated. That crazy world that was just, regular for me was that's ADHD,
Yeah, you really just don't know what it's like on the other side until that's why I'm like so glad that I tried ADHD medication, because I didn't know like what the real world was like. Now I know that I'm in my own little bubble and like I'm okay with it, obviously, because I'm not medicated. At least now I'm aware of it. Like now I know what it's like on the other side.
There's times when I really enjoy going back to that. Like I said, I don't take it on weekends anymore, and that's because I don't know, sometimes I just want to be me. I don't want to be medicated Chris. And while that person is a functioning person in society, there's certain parts of my ADHD that I just enjoy. I enjoy sometimes when my mind's going crazy with ideas and all that kind of stuff. A lot of the time, that's where my brilliant ideas for YouTube videos come. I then need to have my medication in my mind to then actually be able to put pen to paper.
So what are some downsides that you've experienced?
I mentioned before about how the fact that when I took too much medication, I felt like a zombie. My brain like slowed down to the point where I couldn't think properly. I guess you could count this as a downside is prescribed amount has to be right for you. And it can be tough to get that right dosage. Another downside is you have to be so right in your body while you're taking this medication. If you are having bad sleep and if you aren't eating right, your medication just outright won't work. That's where you can run into like the dangerous area of feeling like your medication isn't working, so you need more and you need more and you need more, and that's where you can become dependent on it.
Yeah, when I was on medication, it was working perfectly for a while, and then slowly it just wasn't working, but I was on a really high dose, and so it wasn't like we could really do anything other than like switch medication, so I would have had to completely switch and like start all over again. Now I'm not only like not having any of the benefits of the medication because it's basically not working, but I'm also like not myself. I feel like a zombie all the time. Either I start from scratch, my whole life I'm just like chasing medications, like trying to figure out what's gonna work for me. It only works for a few years, then I have to go out, try something different, seeing if it works. Then you don't notice all the symptoms and side effects and whatnot until like you're a few months or like a few years in, and then it stops working, and then it's just like a big cycle of always trying to find the right medication your whole freaking life. And I'm like, I don't want this life for myself of just always trying to find the next thing that's gonna work. I'd rather just embrace the symptoms rather than having to deal with this my whole life. Feeling like a zombie is definitely a real thing, because it's like I was on a high dose, but it still wasn't even helping me. If I had gone down in dose, then I wouldn't feel as much like a zombie, but then it's still not even helping me, so like what's the freaking point?
You're running the risk of becoming more and more adjusted to the higher dosage, so even if you drop down to a lower dosage, I don't think it would have helped you at that point. Your body adjusts to it and gets too used to it.
And I think that's what it was. I think I had just been on it for a few years now, and I have like pretty intense ADHD, so like I needed a higher dose. The longer I was on it, the less it worked. So then it's like, now what? You're just kind of stuck. You don't have any options other than like starting fresh.
Yeah, that's why I try to like not do it on the weekends and stuff anymore. I want to like manage my tolerance level for it, and although I do get some of the symptoms of feeling like really tired because I haven't taken it, or like a little bit more scatterbrained than normal, or a little bit of a headache because because I haven't taken my Adderall on the weekend for those 2 days.
Whenever I wouldn't take my medication, even if I was just like a few hours later than normal, I would just have all sorts of like withdrawal symptoms. My body was like, take the medication. So a lot of times I would just forget about it or like think I've taken it when I haven't. But then a few hours later, it's like, I haven't taken my medication today. So it's crazy that you like do that every weekend. But I guess it's probably worse for some people than others. And we are on different medications too, so.
A lot of people say that they felt the same symptoms as what you felt. When they don't take the medication, they felt like full withdrawal from it.
So you mentioned how you forgot your medication like on a work trip or whatnot. That's another downside to me because it's like if you forget to order more in time or like forget to set up your appointment so that you can do a checkup so that you can get more, then you're screwed.
Yeah, pretty much.
Yeah.
Well, so I used to have a keychain that was like a little pill bottle thing. Recently, I think it was like Tuesday of this week just gone, I forgot my medication again. I'm at work, I'm texting my wife, I'm like, I forgot my Adderall again today. And she's like, you have to put some in your car. So now I have like a little stash of them in my car. We're always gonna forget. So, you know, I guess it is a downside because it is one more thing that you have to remember.
Also, like, whenever you are used to taking medication, if you don't take it, you're so much more spacey than you actually are.
Yep.
Like, at least for me, whenever I would, like, forget it, I'd be so all over the place.
Every Saturday morning, the first day I stopped taking it, man, I'm a little bit of a space cadet at that point. I have to sit there and outweigh the points. Are the benefits of it more beneficial to me than if I wasn't going to be taking it anymore? Any, like, tests that have been done or any, like, trials or anything like that, there's nothing that really gives a definitive answer to ADHD treatments, especially to, like, stimulants and stuff, like their long-term effects. If you feel like the benefits from it aren't enough for you to keep carrying on taking it, then that's, you know, that's great for you, and it seems to work really well for you. That's great. And there are a lot of people out there that are like you, that they feel like it doesn't do enough for them to take this medication forever.
And that's definitely kind of what the ultimate like deciding factor for me was. I felt like I lost all of the benefits of having ADHD. Like I couldn't hyper focus as well because it was easier to switch from task to task, which is great in some situations, but then I just want to hyper focus and like be myself, you know? So I couldn't hyper focus as well. I wasn't as creative. I just wasn't myself, and I felt like the like little tiny bit that medication was helping me wasn't enough to like not want to be myself and not want to be creative and all that. And I love having like 50 million thoughts. I actually love that. In certain situations, it sucks, but in creative fields, it's honestly such an asset to be able to think so many different things all at the same time.
Yeah. It's true, it is. Speaking from another creative as well, the best ideas come when I'm not medicated, but I need the medication to follow through on those ideas.
Yeah, that's definitely the hard part about not being medicated. So one of the last downsides that I wanted to mention was the idea that people with ADHD are broken and need to be fixed. Especially giving children ADHD medication, it's really setting that precedent that you have something wrong with you. Here is this thing that's gonna help you act like everybody else. And so we're just taking away all of the great parts of having ADHD and covering it up by medication so that we can pretend like we're everybody else when at the end of the day we're never going to be like everybody else.
Sure, I mean, I think that more falls into the parents and the teachers. If you set the premise of that, then that's going to be how your child thinks. It's a tough one because how do you give a child a treatment without making them feel unique to other people who don't have to take that treatment? I mean, positive reinforcement in the fact that they're just as good as everybody else. I wonder if you would even explain their treatment to them until they're at an age where they should know about it.
What would you say to someone who's considering trying ADHD medication but isn't for sure that it's for them?
I would say consult with your doctor. Listen to them, because if their chosen avenue is to do medication, it's probably for the right reason. There's a lot of stigma that comes with ADHD medication. A lot of it is from people who don't have ADHD. Have an open mind about it. Just try it. I mean, it's not going to hurt to try it.
Yeah, definitely. Learn all that you can through people like us who have tried it, through your doctor and all of that. But at the end of the day, like, you don't know how you're going to react to it until you try it. You just gotta try it and see if it works, and if it doesn't, that's okay. Do like cognitive behavioral therapy or any of the other types of therapies that can help people with ADHD.
That's right.
Okay, well, thank you so much for chatting with me today.
Yeah, thanks for having me on. It's been a lot of fun.
If you guys made it here, I know we were very all over the place in this video. Now it's time to go check out the video on his channel. The links and everything will be down below so that you guys can check it out. Thank you so much for watching, guys. I will see you in my next video. Bye.
My neighbor is mowing his lawn right now.
Oh, how convenient.